Greetings from National Academy of Medical Sciences, India. NAMS has been recognized by the Government of India as a nodal agency for promoting the continuing medical education for medical and allied health professionals. National Academy of Medical Sciences encourages and sponsors nationwide CME programs, symposia and workshops in basic sciences and applied clinical disciplines. In the virtual meeting held on 13 December 2022, more than 200 directors, deans, principals, CEOs, faculty members of the medical colleges and medical institutes decided unanimously that there is a need for the NAMS National Virtual Graduated Medical CME, Navigate Medico CME, program for PG students, MD, MS, DNB, MDS. Accordingly, the Navigate Medico CME program was launched on 22 January 2023 by the NAMS President, Professor Dr. S.K. Sareen. Each online session is of 2 hours covering practical aspects as per the needs of the PG students in the identified theme areas. Thank you for your kind support.
Hello, good afternoon, everyone. Welcome to the next joint online NAMS Navigate Medico CME program for the postgraduate students. This time, the topic is really very interesting, and that's unique topic. Hardly we have seen any presentation or discussion on this topic, and today we have very eminent speaker with us, Professor Shiv Kumar Gautam sir. So today's topic will be mental health in ancient India and its relevance to modern psychiatry. So today, to start the program, I would like to invite Professor Ajay Kumar Sood sir for the welcome address. Over to you, sir. Professor Sood sir.
Thank you so much. On behalf of the National Academy of Medical Sciences, it is my honor and privilege to welcome the distinguished eminent speaker for this session, Dr. Shiv Gautam sir. Sir has been NAMS Emeritus Professor, very senior fellow, and sir is also director of Gautam Hospital and Institute of Behavioral Sciences in Jaipur. And we look forward for a very interesting session from you, sir, which, as Dr. Jaswant said, is one of the unique sessions in our present in the telecast so far. So this is on the role of mental health in the ancient India and how it is relevant to the present day psychiatry. So we all look forward for this particular session. Warm welcome to you, sir. I also extend warm welcome to all the faculty members as well as the postgraduate students who have joined us. And this is your own program. Please share your remarks as well any question and queries. You can put in the chat box and sir will be happy to answer in that. So once again, warm welcome to all of you. Over to you, Dr. Jaswant.
Thank you, sir. As Professor A.K. Sood sir, he is Deputy Secretary of National Academy of Medical Sciences. As sir mentioned, sir is really very eminent personality of the India, and he is also Emeritus Professor of Psychiatry for National Academy of Medical Sciences. He is Director Professor at Gautam Institute of Behavioral Sciences and Alternative Medicine, and he is also President of Mental Health Foundation, Jaipur. Sir is former advisor of CCPD, Ministry of Social Justice and Empowerment, Government of India, since 2018. He has been member of Advisory Board on National Human Rights Commission, New Delhi. He is advisor to Rajasthan State Human Rights Commissions. He is National President of Indian Psychiatric Society. He was there in 1999. And sir was senior professor and head of the department, and also worked as superintendent of Psychiatric Center, Jaipur. He has also been the president of Indian Association of Geriatric Mental Health from 2011 till 2013. There are numerous awards and honors to his name. He has been honored with Bhagwat Award from Indian Psychiatric Society, Tilak Venkoba Rao Oration Award. Also, he has been awarded Marfati Award for the best research paper by the Indian Psychiatric Society, Fellowship of National Academy of Medical Sciences, DLN Murthy Rao Oration Award, Lifetime Achievement Award by the Bombay Psychiatric Society, Lifetime Achievement by the Rajasthan Medical Association. Sir is the chairman of Clinical Practice Guideline Committee of Indian Psychiatric Society for last 21 consecutive years. Sir has many social recognitions. To name a few are Ekta Manch Award, felicitation by Jaipur Samaroh Samiti Award for Excellence in Health Services, Gunijan Rajasthan Gaurav Award in 2001, 2002, and Shekhawat Gaurav Award in 2004. Sir has more than 166 national and international publications. He has been editor and author to 17 books, and Sir has also edited a book on healthcare of elderly. So, with this brief introduction, I would like to welcome Professor Shiv Kumar Gautam, sir. Over to you, sir.
Thank you very much, Jaswant, for very kind introduction which you have given. At the outset, I would like to extend my heartfelt thanks to the National Academy of Medical Sciences for very kindly inviting me to share my views on this area, which is an area of my passion. I have been working since a long time, almost 2.5 decades, in order to find out what exactly was written in the literature in ancient India about mental health. And what I did was I screened the literature from Rig Veda, which dates back about 10,000 years plus, to Ayurveda, which is 1400 BC. This is an era when most of these civilizations were yet to develop. And we in India had been thinking about health, mental health, holistic health, etc. So what has been the concept of mind in ancient India? In the pre-Vedic period, Vedic period, era of the Upanishads, which is 5000 to 2500 BC. Treta, the era of Lord Rama, which is 5000 to 4000 BC. Era of Bhagavad Gita, which is about 3500 BC. Ayurvedic era, which is 1500 to 1400 BC. And era of Yoga Darshan, which is 5000 to 1000 BC. Let me tell you that during this period, it was only a human religion which was prevalent in this part of the world, which we call Oriental world. And the United India at that point in time, which extended in a very large geographical area.
Sir, it
is the combined thought. It is the combined thought and wisdom. Are my slides visible?
Yes, sir.
Can you see my slide?
Yes, sir. But the size is a little bit smaller, sir. Niche.
Okay.
Yes, sir.
I am making it full screen. So,
yes, sir.
Let me tell you one more thing. That today's science is what we call as evidence-based. At that time, the entire literature was observational literature, and the observation of people at that point in time who wrote various literature, that became the basis for all this literature. Is it all right now? Is this slide okay now? Okay,
Yes, sir. Yes, sir. This is visible
Okay.
on the complete screen.
right. Then the personality of an individual that was described at this point in time. The three doshas, the personality and the humors of human body, the sattva, tam, and gun, these were described at that point in time. The composite personality, according to Vedanta, was described, and treatment of mental disorders by psychotherapeutic and drugs prepared from plant origin has been described in that era. So I will briefly touch upon, because it's a large subject and I have to complete in about 40 to 45 minutes time. So maybe I will be rushing through some of the slides. Mind has been conceived to be functional element of Atma. That is contrary to the Western thinking. Because in the Western thinking, they say mind is conscious, unconscious, and subconscious mind, which we will also be talking about. And mind has been considered as supreme, with id, ego, and superego as its tools. But in this continent, during that period in time, mind was conceived as a functional element of Atma in Vedas, which are earliest written script of human race. In Rig Veda and Yajur Veda, there is mention of prayer through mantras, that is rhymes, Vedic mantras, Richa, as we call them, for noble thoughts to come in the mind. Thought determine the facial expression. Thoughts can be purified through mantras and purified through influence instincts. In Rig Veda, there is emphasis on the prevention of mental pain, which is equated to depression now. In Rig Veda, when we review the literature, speed of mind, curiosity for methods of mental happiness, prayers for mental happiness, and methods of increasing medha, that is intelligence, have been described. It has been further stated in Rig Veda that purification of mind prevents disease in human beings. Therefore, one should have noble thoughts. The power of mind in healing has also been described in Rig Veda. These days, we are researching on the power of mind in the process of entire healing. That is not only the mental healing, but also healing of the physical organs and various systemic disorders. First time, the three traits of personality, that is Sattva, and Tam, were described in Rig Veda, and also mental illness were independently identified with physical illness in Rig Veda. The three traits of personality, the Sattva, and Tam, were also described in the Rig Veda. Yajur Veda, mind has been conceptualized as the inner flame of knowledge. In 34th chapter of Yajur Veda, the first 6 mantras lucidly describe various aspects of mind, which says what is mind. Perceiving knowledge is mind. Mind is described as yoga and samadhi, the state of mind, and all our sensory organs are under the control of mind and they function under the control of mind. The shloka says, Mana Shrotram, Mana Chakshu, Mano Rasnam, Mano Dhyanam, Mano Ve Brahma Ityupasve. Shiv Sankalpamastu, a mantra which describes the important characteristics of Manas, that is the mind. It speaks of speed of mind, state of mind during wakefulness, that is Jagrat Avastha, and dreamy state during the Swapna Avastha. Mind has been described as the basis of consciousness and instrument of knowledge. Functions of mind have been described and prayers have been made that mind may work for the welfare of all the human beings. Contrary to the Western thought, in our Indian thought, soul, Atma, has been considered as the supreme. And it has three elements, that is mind, that is man, vitality, that is pran, and matter, that is vak. We may see these three elements prevailing us as well as the whole world. Our mind represents knowledge, vitality represents pran and action, and the matter, vak, represents the worldly objects, that is earth and all literature, which we call as Earth Shabda. One of the shloka says that Jnana Janya Bhaved Ichha, Ichha Janya Bhaved Kriti, Kriti Janya Bhaved Karma, Tvadet Krit Mutachyate. That means knowledge begets with will. When we have will, when we have knowledge, then the will starts, and will begets effort, and effort begets action. Actions include all born. I'll give you a small example. You have a dam called Kaveri Dam in Karnataka. An engineer went there in the Jog Falls. It's a beautiful place to visit. When we go there, we go for a touristic purpose and watch the nature. But this engineer, when he went to the Jog Falls, he made a statement, my God, what a waste. People asked him, you call it a waste? He says, yes. The water is falling from such a height and we can produce tremendous amount of electricity out of it. Do you know who was the engineer? He was Sir Vishwesvaraya. He not only created large electricity under the Jog Falls, but he also made the beautiful Vrindavan gardens in Mysore by having a dam on the river Kaveri. What is it? Because he had the knowledge. He imagined that it can be converted into electricity. He had the knowledge. So he could create beautiful gardens like Jog Falls and also electricity supply for Karnataka and half of the Tamil Nadu. So knowledge begets will and will begets action. Action includes our body. The absolute referred to above is the form of knowledge and will is the form of mind. This knowledge manifests itself in the form of will in the world, or the universe is the byproduct of this will. Hence, the gross matter and the vitality prevailing in the material world are the product of will, they are product of manifest and the absolute. In Atharva Veda, Manas has been described as an instrument of hypnotism. In the 6th chapter of Atharva Veda, there is a detailed description of the preservation of willpower. Subjects related to psychology like emotion, inspiration, and consciousness has been described, like grief, envy, pleasure, hostility, attachment, and laziness. Psychosis has been described as Unmad in Veda. I will not go into the details, but this slide mainly talks about Unmad, which has been described as psychosis in Vedas. Then we come to the era of Upanishads. Upanishad literally means sitting near the Guru as a student and listening to the teachers. Secret teaching dates back anytime from 5000 to 4000 BC. We are concerned with the profound psychological insights which is prevalent in the Upanishads. I have here written some of the most important Upanishads like Chandogya Upanishad, Shvetashvara Upanishad, Brahma, Vrihadaranyaka Upanishad, and others, Shankara Upanishad, and others. It was only day before yesterday that I got a call from the University of Rajasthan that one of the students wants to do a delete on this particular topic, that is role of Upanishads in health. And they have requested me to be his guide. He's a delete student. Other important Upanishads will describe Prakriti. Prakriti means personality. And these are the Upanishads which describe Prakriti. This is the era when state of mind has been understood as four avasthas. That is Jagrat, Swapna, the dreaming state, Sushupta, the deep sleep state, and Samadhi, the wakeful consciousness. Various mental faculties have been described in Upanishads. These mental faculties include Ichha Shakti, Kriya Shakti, and Jnana Shakti. That means will, action, and knowledge. 6 important powers of mind have been described. Vedana Shakti, that is power of perception. Smarana Shakti, that is power of memory. Bhavana Shakti, the power of imagination. Manisha Shakti, the power of judgment. Sankalpa Shakti, the power of will or volition. And Dharana Shakti, that is power to hold the knowledge in the mind. Then we come to the next phase, that is era of Lord Rama. Era of Lord Rama roughly existed between 5000 to 4000 BC. This also is called as Treta Yuga. I am not going into the history, because in history, the era differs from historian to historian. But what is more important is what was written in those epics at that point in time, and how it was understood, and how the mind was conceived. Several anecdotes of mental suffering and miseries have been described during the era of Rama. Melancholia and depression of Dasharath, the Lord Rama's father, who suffered from and ultimately died in despondency, is an illustration of the major depressive disorder. Depressive disorder and grief reactions have been described in Ramayana while describing the battle of Ramayana. For example, emotional reactions of Lord Rama when Lakshman becomes unconscious. Here you have the grief-stricken Rama after kidnapping of Sita, his spouse, talking to Lakshman, his brother, and he was in deep depression at that point in time. Then we come to the era of Bhagavad Gita. Bhagavad Gita describes all aspects of yoga, psychology, and is unique among the psychological, philosophical teachings for a student of psychotherapy. Various aspects of psychotherapeutic techniques are described in it. Earliest written description of symptoms of anxiety and depression is found here. You will be surprised how we describe anxiety and depression today, according to the International Classification of Diseases and also the Statistical Manual of the American Psychiatric Association, the DSM-5. Exactly same description you can find in Shloka 30, 31 and 32 of the first chapter of Bhagavad Gita, which says, Sidanti mam gatrani mukham cha parishushate, vepatuscha sharire me rom harshasya jayate. He says, my limbs are frozen, my mouth is drying up, my body trembles, and hair strand erect on it, pile or erection. This is exactly the description of a increased autonomic activity. He also says that I have perspiration in my hands. Gandiva shanste hattakcheva paridayate. The Gandiva, the great bow, is slipping out of my hands and my skin is burning, nor I can stand. My mind is as if it was whirling. And I see inauspicious omens, O Krishna. Nimittani cha pashyami vipritani keshva. Nacha shreyo anupashyami swazane itva swazan mahave. I am not seeing anything good occurring upon killing my own killsman. Arjun the warrior was in a great conflict in the battlefield of Kurukshetra. And he developed severe anxiety and depression at that point in time. And that anxiety and depression did not allow him to fight. And he almost became anxious and sat down by throwing his weapon, the bow Gandiva. He said, my true nature is subdued by the fault of miserableness. My mind is deluded as to what is righteous conduct. I ask you whatever is definitely better to tell me. And I am your disciple, surrendering you to teach me and guide me. That is what he tells Krishna. And Krishna, the psychotherapist at that point in time, changes this losing warrior of the battle of Kurukshetra into a winning warrior, and he carries on psychotherapy. And rest of the 17 chapters of Bhagavad Gita are nothing but psychotherapy of Arjun, which ultimately changed his personality, which made him change himself through yoga and meditation. The techniques have been described, which changed his personality. And the personality traits and types have been described in Bhagavad Gita in the subsequent chapters. And he also tells him, Matra sparshastu konte shitoshna sukha dukhada agama payo nitya tansti tikshva bharata. The contact between the elements, O son of Kunti, are the causes of heat, cold, pleasure and pain, being non-eternal. They come and go. Learn to withstand them, O descendant of Bharata. Today we are talking of neurotransmitters, that it is because of the various neurotransmitters of which I will be talking little later. Krishna tells him that it is the interplay of small elements in your body which makes you feel various emotions and various feelings of Shitoshna Sukha Dukkha. And subsequently, he raises his ego, and to support his ego, he talks about the yoga of action, the karma yoga, the knowledge of renunciation and action, the path of meditation, knowledge of the absolute and eternal, yogic vision, yoga of devotion, profound knowledge of the three gunas, that is sattva, rajas and tam, and the wisdom of renunciation and liberation have been described at length, which leads to personality transformation of Arjun. In the modern psychotherapy, cognitive restructuring is the goal of psychotherapy, which has been accomplished a great deal through Bhagavad Gita. So here you can see the winning warrior, victorious Arjun, after the psychotherapy by Lord Krishna. Then we come to the Ayurvedic era, which is 1500 to 1400 BC. Charak Samhita, that has been written at that point in time. Ayurveda derives its root from Atharva Veda and is one of the ancient science, which means science of life. Though the principles of Ayurveda find a mention in Vedantic treatise also, the classic written document Charak Samhita is 1400 BC and Sushruta Samhita is 1500 BC. These two classics were describe the mental disorders, personality types according to the three gunas and three humors of the body. They describe 14 causative factors of mental disorders in Charak Samhita, which I am reading one by one. Prajyaparat, wherein the envy, pride, fear, anger, greed, attraction, proud, deluded thinking are the emotions which are responsible for causation of mental disorders. It talks of Anuchit Brahmacharya, it talks of Durbal Sattva, it talks of Durbal Sharir, it also talks of Sharir Dosh Vikriti. This Sharir Dosh Vikriti, that means the psychosomatic disorders which have been described in this particular time. Manas dosh, the psychological factors, the trauma to the mind because of the substance abuse. There are certain substances which derange the chitta, that is alcohol and other opiates. Agantuk karan, exogenous factors like trauma to the body, other outside bacterial infections. Then it talks about the evil spirits, which is an imagination in the individual's mind. Malin ahar vihar. These days we are talking of the brain-gut axis. It has been described at that point in time that bad food and bad lifestyle both lead to mental disorders. Manovigar, trauma to the mind because of stress, is extremely pleasant and extremely fearful events. The stressful life events which we are describing these days, they lead to unmad. That has been described in Ayurveda. Then Ashant Mana, the conflicting issues in the mind and doing actions mentioned in Pragyapara, Ojokshay, Ayukta Nidra, sleeplessness, and Chintaman. These 14 causative factors have been described in Ayurveda. Then the classification of diseases in Ayurveda, that includes natural, traumatic, physical, and mental disorders. Again, a holistic approach, and amongst the mental disorders, niche and agantuj factors have been described. I am not going into details at the moment. Then Yoga Darshan is the era between 5000 to 1000 BC. And in Yoga Darshan, yoga has been the way of life in ancient India. There are many aspects of yoga which are not commonly known. Some of the systems and principles of yoga have been outlined in different Vedic and Upanishadic scriptures, as well as Tantric traditions. There are 8 common points known as Ashtanga Yoga, or the eightfold of, or 8 path of yoga. And these include Yam, that is restraint, Niyam, that is discipline, Asanas, the body posturing, Pranayam, control of breathing, prayer, Pratyahar, that is withdrawal from the lucrative things, Dharana, that is fixed attention, and Dhyan, contemplation, and Samadhi, the state of complete tranquility. These are the 8 paths which have been described in Ashtanga Yoga. The set of last 4 exercises are concerned with psychological dimensions of the personality, and these basic principles of Ashtanga Yoga can be used with any system of yogic techniques. 6 yogic disciplines have been described in Upanishads. That is Karma Yoga, Jnana Yoga, Hatha Yoga. Jnana Yoga is yoga of knowledge, Karma Yoga is yoga of action, Hatha Yoga is yoga of attaining physical and mental purity, Shuddhi, Raj Yoga, yoga of awakening the psychic awareness and facilities, Mantra Yoga, the yoga of freeing the mind by utilizing a sound vibration, Lay Yoga, the yoga of conscious resolution of individuality. The aim of these spiritual practices is to convert self. One of these yogic disciplines have been specific techniques of life, lifestyle, attaining self-realization. The traditional Shat Karma of Hatha by the renowned Ayurvedic physicians, they are Neti, Dhoti, Basti, Nauli, Kapalbhati, and Pradhan. The later additions to Hatha Yoga include Ahimsa, Asana and Pranayam, and Bandha and Mudras. The popular yogic techniques being widely used they are being used even now, and adequate evidence-based researches have been carried out on these techniques, which I have narrated the publications in various journals in these days. They include Raj Yoga. There is a publication in 1993, Vipassana, 99, Preksha Dhyan, it is by Mahapragya 1987 and 1988. Meditation, pranayam, hatha yoga. These are various things which are being followed in the present era as the techniques of healing. Those sattva, rajogun and tamogun, the trigunas were conceived even in Vedic period. It was during the time of Charak, that is 1400 BC. That physical characteristics of personality and Manas Prakriti, the characteristics of personality according to the mind, they have been described in Charak and Sushruta Samhita. And basic three personalities recognized are pure, that is Sattvic, passionate, that is Rajas, and ignorant, that is Tamas. Then various Sattvic personalities have been further classified into Brahma, Rishi, Indra, Yam, Varun, Kuber, and Gandharva. These personalities have various traits and how these particular people have been behaving. According to that observation, the personality types have been described in Ayurveda. Among 7 types of described personalities, Brahma type is considered as the most desirable, since the beneficent aspects of mind is represented in it. Nevertheless, all the personalities are beneficial to the society in which they live. Then we have Rajas personality, which has been subsequently further classified according to, you see here in Ayurveda, the ethology and science was correlated. What are the characteristics of a snake, a pret, a bird? According to that, the personality, Asur, Rakshas, Pishach, all these personalities have been described. Again, like animal type, fish type, plant type, they have been described. It may be seen that Ayurvedic writers conceived personality as comprising of multiple dimensions: intellectual, social, emotional, spiritual, and moral. This Sattvic Rajasing represents the intellectual, emotional types, respectively. The Tamasic group broadly represents the intellectually deficit type, and the descriptive type of mental deficient as animal, fish, plant varieties is an interesting phenomenon. In an interesting study of typifying the personality, this work was conducted for a PhD thesis by Ahluwalia under my supervision. We compiled the signs and symptoms of Prakriti given in 2 Samhitas, that is Charak and Sushruta, and found that there are 477 characteristics according to which Deha Prakriti, the physical characteristics, and the Manas Prakriti can be described. Well, personality layers were also described. Composite personalities created by Atma functioning in the body, mind, and intellect. And according to the Vedanta treatise, there are Pranamaya Kosh, that is food sheath, Pranamaya Kosh, that is vital air sheath, the Manomaya Kosh, that is mental sheath, the Vijnanamaya Kosh, which is intellectual sheath, and bliss sheath, that is Anandamaya Kosh. That has been described, and it has been conceptualized that the human mind is in union with the cosmos from the vital sheath to the Anandamaya sheath. Then further, how the sense objects, actions, emotions, thoughts of world and thoughts of reality, they have been further classified according to the mind, body, mind, and intellectual. So the body-mind relationship and the intellectual relationship under the control of Atma has been described since then, which we are talking now. We also talk about the mind-body relationship in holistic health today that was described in that particular era. These are the various sheaths which I have described just now. Then in the treatment of mental disorders, as opposed to modern psychiatry, where the diagnosis is based on phenomenology, in Ayurveda, the diagnosis was based on etiology. Also, the lifestyle, ahar vihar, what one eats and how one enjoys his behavioral life, that has been taken into consideration. Psychotherapeutic management by advice of yoga, meditation, and medical management, use of plant medicine of various permutations and combinations were advised then. The plant medicinal use, combinational medicines, there are 10 types of medicines which have been used and which have been described in that era. Medhya, that is to improve memory. Madhkari, to treat the intoxication. Sangyastan, the analgesics to improve the conscious level and mental faculties and to relieve pain. Jivaniya, that is tonics. Shiro Virachan, for local application on the head. Unmad Nashak, the antipsychotics. Apasmar, anticonvulsants. Medatya, used for de-addiction. And drugs for insomnia and hypersomnia. These are 10 categories of psychopharmacological agents of plant origin which have been described then. Now, what is the relevance to modern psychiatry? In recent past, there has been a lot of research on use of many Eastern techniques of healing and health sciences. Lot of emphasis is being laid on the lifestyle and health. In modern era, it's increasing stress, which is calling for stress management techniques and medicines devoid of side effects, which increase the importance of alternative methods of medicine. Some Ayurvedic combinations have been used anti-anxiety, antidepressants. Reports are available from the National Institute of Ayurveda. I happen to be on the scientific advisory committee of the National Institute of Ayurveda. And we have used Vacha, Jyotishmati, which were found useful in the treatment of depression. Unmad Bhanjan Ras, a combination of 24 compounds, was found to be having antipsychotic effect equivalent to chlorpromazine. While communicating with cancer patients, we have published this work in the British Journal of Psychiatry in 1987, that Indian patients tend to accept the diagnosis of cancer rather easily. The concept of death prevalent in Indian culture, based on the philosophy of Gita, where soul is accepted as immortal and it is believed to transfer through the death from one to another human being. It helps an individual to accept the death and diagnosis of cancer and planning for the rest of the life. Well, these ancient texts should be re-explored as the models of conflict resolution, understanding psychopathology, attainment of self-realization. Modern research on various techniques of yoga are available. Ways of lifestyle are available. Implications in understanding the psychopathology, psychotherapy, drug management, and stress management have been described in the ancient literature. What is the relevance to modern psychiatry? Various techniques of yoga and meditation. For example, Preksha Dhyan, Buddhist techniques, Vipassana, Transcendental Meditation, and Raj Yoga. Even now, evidence-based research is available on these techniques, on pranayam, Sudarshan Kriya, Reiki, pranic healing, mindfulness, and positive psychology. These techniques have come from the ancient Indian thought and widely used worldwide even these days. It is thought that yoga is a spiritual science. Partly it is true, but latest advances have proven that we not only achieve an ideal state of psychophysiological health by practice of yoga, but it helps in improving the individual's spiritual status and optimal functioning of body and mind. The current evidence base is available in the literature on yoga. Other advantages of yoga, we have significant reports of improvement in depression as an add-on antidepressant technique. Other advantages of yoga in depression have improvement in anxiety, behavioral activation, non-judging facets of mindfulness. There is a published report on improvement in depression and life satisfaction in an elderly depressed woman when they used yoga against the Tao technique. The current evidence base also includes a study which shows that significant improvement in depression among patients with post-traumatic stress disorder. Breathing interventions alone and in combination with exposure therapy in real-life situation were useful in the improvement of symptoms. Possible mechanisms of these techniques include increasing gamma-aminobutyric acid neurotransmitters in the brain, improving sleep, decreasing ruminations, and promoting behavioral activation. There is a report which says that comprehensive effects of neuroendocrines and physiological, social, and spiritual factors is related to substance use disorders. So in conclusion, what I feel is that these ancient texts should be re-explored for models of conflict resolution, understanding psychopathology, and attainment of self-realization. I am recently in the process of publishing my book on this particular topic, that is ancient Indian literature and its contribution to the modern world. Hopefully this book will be available next month for the readership. So, and in that book, I have described at great length about these various methods and the concurrent so-called scientific evidence base on these techniques which is being used in mental health as an alternative method of therapy. Last comment which I would like to say, that it is during the British rule that these therapies were called alternative methods, because they said that what has come from the West is the best, and that is the primary method of therapy. For us, this was the primary method of therapy, and what we call as modern medicine is probably the alternative method of treatment, which is more acceptable in the Indian culture. However, it's a matter of debate. I will not go there, and I would like to close here by thanking you all. And this is the institute where I work. We are Institute of Behavioral Sciences. We are connected with 4 universities of Jaipur city. We are training mental health professionals. We are affiliated to 17 colleges of nursing. We are training nurses, clinical psychologists, and doctors in mental health. Thank you very much.
Thank you, sir. Thank you very much for the wonderful presentation. Sir, the first comment is from YouTube that has been posted that thank you for very interesting topic, sir. Will the slides be uploaded on NAMS website? So I think
yes, Jaswant, I did not hear your comment properly. Maybe some network problem. Can you repeat it?
yes, sir. The first comment is from that is written in the comment box on YouTube. That streaming. The comment is, thank you, sir, for this very interesting topic. Will the slides be uploaded on NAMS website?
Well, I thank the Academy for kindly providing me the opportunity to share this. And I'm sure we will be further interacting one-to-one when we meet in Jodhpur.
Right, sir.
If there are any, I can find very few people on the chat here. There
are people are writing now. Yes, sir.
27 participants. So can we open the chat and see if there are any questions?
Yes, sir. One is from Dr. Preeti. Sir, any specific food to be advised or avoided in mental disorders?
Well, if you carefully read the chapter 17 of Bhagavad Gita, it talks about food and mental health. it is very interesting. 17th chapter of Bhagavad Gita talks about what is sattvic food, what is tamasic food, and what is rajasic food. And relationship of food to Bhagavad Gita, food to health in general and mental health in particular, has been described in chapter 17. One of the things which it talks about for health is that food cooked prior to 3 hours is contraindicated in health and disease. So it talks about the fresh food. And fresh food, if you take cooked less than 3 hours, I'm sure because of the warmth, because of the cooking, all the bacteria get destroyed and we have food which is health friendly. Then it also talks about certain foods which are contraindicated. I would advise you to go through that chapter and learn it.
Thanks, sir.
Then,
Sir, Dr. Shakuntala is there. She want to say something. Ma'am, you can unmute and you can
yes,
ask, ma'am.
I'm so happy to see Shakuntala on the screen.
Hello, Shiv. I'm logging in from Chicago.
Shakuntala happens to be my classmate in undergraduate period, and I am very happy to see her from
So
on
I'm
this
logging
screen.
in from Chicago. I especially put alarm, to listen to you because you are always so brilliant. And I would say that it is good luck of people who are able to actually relate to you and connect with your thoughts and your literature. In fact, I'm looking forward to the book which is coming, and you know that I have been asking for it
I
for
have
such a
been
long time.
gradually, Shakuntala, frankly speaking, I have been gradually updating it.
So,
In the last 2 years
but
also.
one thing, which I
And
want to,
now it has come to final shape.
so I want to actually, tell you that whatever you told is really, really evidence-based. And in, colonial era, the evidence was lost because we started reading whatever was being taught to us and we neglected whatever was ours because through thousands of years of research, maybe more than 5,000 years, our rishi munis who were really scientists and they were actually practicing in laboratories by making inner domain as the laboratory. Because whatever you say that okay, now it is cold, it is hot, I'll switch on the AC, I'll do this, I'll do that. But our rishi munis, they just use body as a laboratory and they devised so many methods to heal, so many methods to develop coping skills. And coping skill is the need of the hour. So many cases of suicide, this, that, whatever adverse can happen even to youth is increasing at random, I mean, absolutely rapid speed. So your type of lectures, especially to society at large, to youth, to parents, to would-be parents, are so relevant. And actually, there should be some method that people absolutely inculcate everything in everyday life. I mean, I would just recall, Akshay, I have not been in this field, but for 5 years, I had taken up a project of WHO on drug de-addiction. And, we presented that paper in International Conference of Alcohol and Addiction in Glasgow. And where we have shown, and that paper is published in BMJ, that yoga has, uh, not only cure, but relapse prevention was possible through yoga. So, I mean, you rightly said that
Especially
these
the
should not.
transcendental meditation. Yes.
Yeah. So we should say that these should not be called just as asana, or
No.
exercise or breathing techniques. These are really, really very bad words. Yoga is absolutely something which has to be inculcated into our breath and our heartbeat, like how we are alive. We are alive because of yoga, and our life can improve. Absolutely, absolutely, 100%. I would say that if we practice the yoga which has been described, not only asana, but every aspect of yoga, it says that how you should live, how you should behave, what you should eat. And you rightly said that this is the science which is absolutely evidence-based, and this is the science which is need of the hour. And this is not modern, this is ancient science. And modern science, of course, I would not condemn it, because of course it is very much useful for emergencies, and we know that how lives are being saved, how surgery is being practiced. All those things are not worth condemning at all. But if we incorporate this as a basic science, then maybe need for all those things will not arise. And what is
Thank you
modern
very much.
medicine?
I think
Pharmacy also a
the words coming
plant-based.
out of a pediatrician's thoughts. Dr.
Yeah.
Shakuntala is a pediatrician by profession, and such words coming out of a pediatrician are very encouraging.
No,
And
no, I'm really
I
absolutely
fully
convinced.
agree with you that yoga has been a lifestyle.
Yeah.
When we are concentrating and reading, it is Raj Yoga. When we are meditating, it is Raj Yoga. When we are playful, it is Hatha Yoga. When
And
we
first
are
of all,
we are
you
singing
stop
together in the
stop
temple,
calling
it is
it as
my
yoga,
yoga.
call it as yoga.
Yoga is the way of life in our country.
Yes.
Absolutely.
Yoga is actually pride of, human beings.
Absolutely.
And I would say that even animals practice yoga. We
Oh,
cannot actually, yes, we do not notice it, but they also
we,
practice yoga.
we
So
have to
I'm,
learn from
yeah,
mythology.
yes. So I have to congratulate you, and I'm so delighted to actually, hear you. And I would say that, you should come out with more and more such participant lectures, and more people
Just,
should be encouraged to
just
participate.
to add one more information, that mental health and well-being and coping strategies, that is the chapter which I have added in the book in the last few weeks. So
Okay.
it is in print, and as you said about the coping strategies, I have written one full chapter on the coping strategies for
Thank you.
health and disease.
So is the book available on
in the last
Amazon, or
chapter.
how do one get it?
And second is that this book is now will be available in English as well as Hindi.
Very
Two
good.
languages. Same thing in two languages. Two editions are coming simultaneously.
Congratulations, hearty congratulations. And
Thank you.
Thank you for your time to me
बुक
on this
कैसे
chat as well.
परचेज कर सकते हैं पार्टिसिपेंट्स
I will
वो थोड़ा
certainly
सा
share
बताइए
it personally with you.
सर पार्टिसिपेंट्स या बाकी लोग कैसे अवेल कर सकते हैं बुक को लाइक थ्रू अमेजोन और थ्रू
We will talk in Jodhpur, Jaswant.
राइट सर राइट
About the process.
राइट सर श्योर सर
And I'm looking forward that it is released in our national conference of the academy.
That's great, sir. That's great, sir. Sir, thank you, sir.
Okay.
So I think there are no further questions.
Thanks. We can thank the chair.
Sir, yes, sir. I would like to request Professor A.K. Sood, sir, the Deputy Secretary of National Academy of Medical Sciences, for the vote of thanks.
Thank you so much, Dr. Jaswant. Again, it is my great honor and privilege to thank the distinguished speaker for this evening, Dr. Shiv Gautam sir, for covering this topic very comprehensively, starting from the ancient Indian literature and coming to the modern medicine. I'm sure that all the participants have really appreciated that. And special thanks to Dr. Shakuntala for her comments and observation. So thank you so much for your support and blessings to National Academy of Medical Sciences. And we look forward for your blessing in future also. I also take this opportunity to thank all the participants, especially our faculty members from various medical institutions, as well as the PG students who have participated in this particular session and made this session interactive by asking questions. So we look forward for your comments and support in future also. We have started this program in January 2023, and now it is nearly 2 years. So we look forward for your suggestions and for making it better. And special appeal to all the faculty members, please join us as a resource person and select some topics for discussion during the subsequent session. So once again, I thank all the faculty members, participants, PG students for making this session very interactive. And just for the information of our PG student, we have started two other programs, especially for the PG student. One is with the help of Indian Council of Medical Research. We have a national biostatistical helpline, and all the PG student, if you have any query related to samples, sampling technique, your thesis, your tools, data analysis, you can just register online on this site, and this detail we are putting in the chat box for your information. Second is in collaboration with the International Institute of Information Technology, Hyderabad, NAMS has started a 12 weeks online program on artificial intelligence in health, especially for the medical professional. So this program is again, we have started the first batch, and the enrollment for the second batch which is going to start in the month of January is there, and you can also enroll for the second batch, because the first batch we have enrolled more than 142 students and health professionals. So this program is 12 weeks and an online program where every week there is a 3 hours session. 1 hour session is for lectures, whatever thing. Second is for contact program where you the expert will sort out the queries, and third is the demonstration. So 3 hours per week and total 12 weeks. So this again is going to be very important for our health professional, especially the modern technology, artificial intelligence, how it can help you in your clinical practice and diagnosis. So I again like to thank Dr. Jaswant, who has been associated with us for the last 2 years, for your valuable support and blessing. We are really grateful to you for your this support as a moderator and coordinating this program. Once again, I thank the IT team over here, Mr. Ravi and Mr. Shivam, who has been making this transmission possible on Zoom as well as on the YouTube. And all these recordings are available on the National Academy of Medical website. So those students who want to again go through these, you can always go to our NAMS website, and even you can download these videos. Also, these are available on the YouTube. We have a channel, YouTube channel on NAMS Academy of Medical Sciences. So once again, I thank you all for being with us and making this evening very, very interesting. Special thanks to Dr. Shiv Gautam sir for being with us and giving us your valuable time. It was really a very great session. All of us have learned from you. Thank you so much for your blessing. Over to you, Dr. Jaswant.
Thank you, sir. Thank you for the kind words. And I think, sir, still the comments are pouring for the praise regarding the session. So that was really very informative for the participants. And thank you. And with this, I think we can mark the closure of the session. So with your permission, sir.
Thank you.
Thank you, sir.
You can leave now.